I think we can get started. For people jumping on even a couple of minutes late, we are recording this because there's a significant amount of interest in this opportunity and this particular funder. So thanks to all of you who are jumping online to join the conversation. My name is Jill Cizek. For those of you who we have not met, I work under Dr. Brashear with the hat that she wears as Vice President for Health Sciences. And over the course of the last 8 months, we have identified funding opportunities that are probably larger scale and sometimes a bit more unique, that are specific to the health sciences or very heavily focused on the health sciences. So I want to take a minute to thank Dr. Geoff Bartlett, who is the Assistant Vice President for Corporate and Foundation Relations in the Division of Advancement. His office does a wonderful job of navigating relationships with corporations and foundations for the university, and specifically this particular funder, which is they're new, they're fresh. We're always learning, I think, from them.
As are they. They're learning from their own process.
Right. And so Dr. Bartlett has a wealth of experiences, not only in the corporate and foundation space, but actually has been with the Division of Advancement in a leadership position for quite some time. So I want to thank him for taking the time to prepare for this. He and I were just discussing before everybody started to jump on that this is extremely timely based on the date that we selected for him to give this talk, and he can explain exactly why. But I'm sure that many of you, if you're on the list served for Cabrini, are probably familiar with why the timing is really good for this. The intent really is for everybody to take an opportunity to quiz Dr. Bartlett, ask him any questions that you might have, whether it be fit or opportunity, and then hopefully be able to minimize a lot of, because there's a lot of activity situated around this, especially with only one call per year with this particular funder, and to basically streamline as well for his office in keeping in consideration everything that he discusses on this call, so that we are really putting things in front of the funder that are impactful and truly aligned with their priorities. So thank you, Dr. Bartlett, for taking the time to do this. And if you want to share or whatever you do, we're ready to roll.
Great. I'm going to share my screen here and say again, thank you for the opportunity to present to you. Hopefully you all are seeing this as it comes up. I've got just a couple slides as you see here that are really high level sorts of things. Jill, which screen are you seeing right now?
I'm seeing yours. I'm not seeing presenter view, but Jeff, it's fine if this is working for you. It's fine.
All right, this
perfectly legible.
So what I have are just some really high level slides. What I really want this to be is much more of a conversation for you to be able to ask questions, and I can share as much as I'm able to share based upon our knowledge of Cabrini's process, their priorities, what they look for based upon our conversation. So I'll kind of run through the LOI submission process, the timeline, all those sorts of things. But then really, as I said, hope to be able to answer more questions than to hear me just drone on and on. Jill had mentioned the timing, which again, the coincidence of the timing when we set this up and talked about this back in September, October, it may have been that early, and kind of said, well, let's do something, end of March. Typically their call has been mid-May, early mid-May call. This year it's April 1st through the 25th. So, again, the timing for us to have this conversation aligns perfectly, although albeit maybe a little quicker than what any of us had intended. So that's why we're here. So process for submission is very similar to what it's been in the past. As I said, LOIs will be due Thursday, April 25th. 5 o'clock is usually the cutoff time for that. So the portal will open up on April 1st. We will be able to have a much better understanding of if things are going to change once we can get our hands on it. But know that April 1st, things open. Everything is due April 25th. Based upon our conversations, we don't anticipate the LOI changing much, if at all. But again, we'll know more once we can get into it. The grants, there's always a question of how much, right? The grants range from $75,000 and up. I can tell you that the successful ones that we have put in the last couple of years have been in the $200,000 and $300,000 range. So gives you a sense of really what you're looking at. I think the important part too to remember is that they have two start dates, October 1st and January 1st, and that's really important, not only for you to think about when would your program start or your project start and end, and it's typically a 12-month project, but also then when we might hear about a submission, because we find that if something starts after January 1st, they will delay decision until their December board meeting. So something to keep in mind as you're thinking about timing as well. I have an example of this briefly. Even though this is an LOI, it's really important for you to work with SPS and whoever you work with on budgets. You won't have to click through, but they will require a preliminary budget for some of this. And the wrinkle in the budget conversation is Cabrini actually has their own budget form, so which we'll share once we've got, again, all of that available. So work with your SPS person to help develop budgets, but know that you're going to need to translate all of that into the Excel spreadsheet. And when we're done here, I can kind of share real quickly what that's looked like in the past. And then we will, as an office, corporate and foundation relations, will actually upload everything and submit on your behalf. This is really a request by Cabrini so that there's one portal instead of every PI having their own login. So, we'll work on that. So it's, again, really important just to communicate with us that you're interested, that you want to move forward, and so that we can just kind of keep track of who we expect to apply and not. Last year, we had 12 applicants, 2 move forward to the second phase. The year before, it was 16. I think 2 or 3 move forward. So it tends to be that sort of volume and ratio when we start talking about these sorts of things. Timing, as I mentioned, LOI submissions, due April 25th. They will turn around things fairly quickly. We should know within 3 or 4 weeks of who gets invited for a full proposal, but know that that invitation is a really fast turnaround. Once we hear, you're going to have a month or less to finalize that proposal and submit it. And again, we're happy to work with you and on all of that. And then, as I said, those grant decisions will be either October or December, depending upon when you have your start date for the project. A couple things to keep in mind. Cabrini receives more than 1,000 LOIs each year through their call, and typically invites about 1/3 to full submission. Our track record is, if you get invited to a full proposal, you've got a pretty good shot at getting funded, but there's no guarantee in any of this, right? But know that that's kind of the ratio. So as I said, last year we submitted 12 LOIs, 2 were invited. The year before that it was about 16. So we expect a similar volume, if not more, dare I say, simply because of the excitement that we're hearing about this and the interest that we've heard about it so far. A really important distinction with Cabrini: they do not fund research. They are a direct services downstream sort of funder. They really want to make sure that their funding is having direct impact on communities. So it's something to keep in mind. If you're thinking about Cabrini as as a supplement to some research, probably not a good fit. The other thing that they're really interested, they have 5 basic priorities: access to healthcare, basic needs, healthcare workforce, mental and behavioral health, and then general support. Really important to think about how your project fits into one of those 5 categories. Our conversations with them, the things that tend to get funded, the things that really they get excited about, have really defined characteristics and estimated numbers of a population being served, a clear timeline of what you're doing, quantifiable impact, descriptions, community partners. So the clearer that you can be in what you're trying to accomplish, who you're working with, who you're partnering with, what you're trying to, what the gap is, that's going to interest them much more than something that's a bit more generic or under development. We had a conversation with Cabrini and one of the projects that they funded a couple months ago, and one of the comments from the program officer was what excited them the most is that they were crystal clear in who their partners were and illustrated the depth of connection they had with those partners. So again, they're really looking at how are we going to be able to make a real impact in the community. Note to anyone who's currently a grantee, our expectation is that if you are looking for a renewal, you will have to go through the LOI process. There's not a guarantee renewal in any of this. So just something to keep in mind there. And then I will share all this so that you've got it, but a couple great websites for Cabrini, just some FAQs that they have, and also you can kind of dig into projects that they have funded previously. So that is what I wanted to present, again, from a high level, but I think, again, the value in this conversation is really the questions that you might have. So I'll stop sharing and welcome questions that you have.
Thank you, Jeff. So if you have questions right now, feel free to put them in the chat or put your hand up. First of all, Jeff, thanks for taking the time to do it.
Oh, you're
I
very
know
welcome.
that your office is going to be wildly busy during the month of August or April as a result of this. Because Jeff and I have worked on this together in the past, I just also wanted to mention one or two things. Cabrini, to put it in context, for those of you if this is unfamiliar or if it's new territory, I think it's always great to contextualize it based on our space in Buffalo. The Oshai Foundation is a foundation that has about $350 million in total assets. It's the biggest foundation in town if you exclude like Ralph Wilson and the Community Health Foundation when you include all of their different portfolios. And so I think that's been the go-to for many of us here at the university. Cabrini has about $4 billion in assets. So their ability to invest and to give is magnitude greater. And over the course of the last couple of years, because I have been fortunate to engage with some of the program officers, based on the office that Jeff is in and he's leading, is that they do recognize that, and they're only focused in New York State. They do not fund outside of New York State. They're only in New York State. They recognize that Buffalo does not have the same level of philanthropic support from a foundation vantage that, say, New York City does. The program officers are aware, their leadership is aware, which I think is something to keep in the back of your mind as you're going through the process, to just be optimistic, because the awards that they have given, even in their infancy, have been very strong. Jeff, I guess if I can ask the first question, I know Dr. Quatrin has her hand up, but can you talk a little bit about the Catholic foundation of the organization and how it might impact, especially some of the programs or anything that's being proposed from health sciences investigators?
Yeah, I appreciate that question, Jill, and had pulled some information figuring that might come up. Yeah, I think one of the things that you absolutely need to know is, again, the way the Mother Cabrini Health Foundation was created was by selling of, I'm drawing a blank on the name, insurance company that was really built for, the Catholic Church and Catholic health. So the mission of the Catholic Church is central and critical to their mission and vision. They look at all submissions through that lens. So if you are thinking, there's something that you're interested in, but it might be at odds with that mission, probably not something that you should put forward to Cabrini for. We can have a different conversation of what that might look like, but that's really a critical part of it. The website, if you go to the Cabrini website, they actually talk about this as part of their application process and funders who are or projects that are actually funded, you actually have to sign off and agree that the work that you're doing is within the confines of the Catholic mission. So a really critical part of how they approach their work.
Thank you.
Jill, do you have another? Teresa?
Dr. Noyes had a question about, of the two that were invited to full proposal last year, which ones were funded? I said both were funded.
That's correct.
As was the case the year prior. Generally speaking, the trend thus far has been, if you're invited to full proposal, no guaranteeing timeline, but they have been funded. So if you work with Jeff's office, yeah.
Not a guarantee to that, but that's certainly been the track record. And as Jill mentioned, because of the work that we've done here in Western New York and the connection, we seem to get a lot of positive response to our submissions as well.
Dr. Quatrin, you have a question?
Yeah, as I recall from the past, the LOI is not very involved, but I can't remember, because as you pointed out, there is a very quick turnaround. I can't remember how involved is the actual proposal.
When we are able to pull everything, we'll create a template. While I've got you, let me show you what we're dealing with here, because I think that's a really
because then the proposal is due by the end of June or June 1st.
We don't know the timing of that yet. We'll know once the portal opens and all those details are laid out. Right now, all we know is it's sometime it'll be in June. Mm-hmm. And as I said, typically it's about a month's turnaround. So, but you're absolutely right. Here's the format for last year's LOI. And I'm happy to share this, although, again, whether or not it changes, but, you're right. The program description, 5,000 characters. So, not a lot of space there. That can't be right. 5,000 characters. It's gonna be 500 characters. What I want to get down to is general budget. I'm looking for something else here. And again, we'll share this once we've got the final version of the LOI for the year. So maybe it is 5,000 characters, but that's for the entire description. So really what you're looking at are a description and intended outcomes. Again, really important to Cabrini to spell that out in the initial LOI. We'll share again the template once we have it with everyone. And once we're able to share the template for the full proposal, we'll do that as well.
And in the actual proposal, is it I don't know, NIH style? Is it something very involved, or or
Jill, you would know better than I in that comparison. How would you compare it?
I honestly think that it mimics more of a PCORI format than it does NIH.
Okay.
Like community partners, who are the members of the community that would be impacted, a milestone, like they will want to know your milestones, like what that looks like over the course of a 12-month period. So I think it's probably closer to PCORI than it is NIH.
Okay, yeah, but and PCORI really, Jill, the LOI is not that complex, but the application is very complex. Right. So just okay. Thank you.
But you can see from like what the question that Dr. Noyes had, that if you are invited to full proposal, the CFR office has done a remarkable job in making sure that those applications are put together and are funded. The success rate once you've been invited to full proposal, I think has been, I don't know, Kathy's not on the call, but probably about 100%.
Yeah,
They're pretty
I
gosh
think
darn
so,
close.
yeah. And I would say that one
So
of the
time
things
well
that we,
spent.
one of the things that we can do from our office standpoint too is ensure that all the wraparound material is provided. So you really just need to focus on, the project. We can provide, all that boilerplate language, so you don't have to worry about that.
Jeff, we have a question from Dr. McPherson in public health. He said, how do you recommend selecting one of the 5 priorities when a project may be related to 2 or more?
Our sense, so if the question is, does one priority rise above another priority with PCORI? My sense in our conversations is no, they're not. I would think that maybe the one area where you might want to give that to some consideration is kind of the general support, if you can be a bit more specific. I think if you've got 2 that, if it's workforce development and mental health, I would say pick, at least in the dropdown, pick the one that seems to resonate the most, but then build into the narrative that this touches on multiple priorities and really spell out how it touches on those priorities.
Great. So we have a question from Dr. Howitt in the School of Nursing.
Oh, yeah. Can't hear you.
Oh, maybe you're on.
Babe, are you on mute? No, you're not. Nope. Okay.
Your microphone's still not working.
Still not working. Well, she's figuring things out. Other questions?
What is the best way, even though the deadline, even though the LOI opens up on April 1st, how should any of the investigators who are on this, should they communicate with you now if they have an intent?
Yes,
to
please.
submit?
Yeah, again, I think, coordination and just keeping a master list of who's interested is going to be critical. So if you can let me know between now and April 1st that you're interested in submitting something, we'll make sure that you get the template. Everyone who's on this call, I'll share all this information with my contact information as well so that you have it. But I would absolutely say yes, please. The sooner we can start to get a sense of who all is interested, the better we can figure out what our month of April is going to look like.
Okay. Dr. Howitt, you got the microphone figured out?
Let's see, can you hear me now?
I can hear you now.
Awesome.
We can. Good.
Yeah, the School of Nursing is definitely interested in submitting a proposal. It's not clear to me. I can see on the Mother Cabrini website how to apply, but you had mentioned that you want everything routed through your office. Did you send instructions for how we do that?
Yeah, so I haven't, but basically we'll work with you. You'll just send us the narrative and we'll upload everything into the portal.
Okay.
And every project will have its own submission with all the wraparound material and everything. But yeah, we'll work on that through, PDFs and Word documents and Excel spreadsheets, and we'll just upload everything once you've signed off on it.
Okay, thanks.
Yeah. Yep.
Jeff, we have another question from Dr. McPherson in public health.
Yeah, thanks for this. This is really helpful. So in looking at the website, there's some sort of recommendations or things that they like to fund, but then it sort of leaves the opportunity for exceptions to that. So an example is the 1-year funding, and then another is related to more capital expenses. Has UB been successful in obtaining funding that either went beyond 1 year or included some of those other costs, not necessarily related to direct service, but setting up the capacity for providing direct service?
So let me answer. So yes, we've had one project that's extended a couple of years, although there's been a renewal there.
Okay. But the first go around was 1 year, and then they
and typically they will only fund for 1 year, and then you have to ask for the renewal.
Okay.
Jeff,
So
do you want me to help?
Typically, but not all. I'm just trying to understand, is it really a hard rule and it's just not written that way, or do they commonly or with a reasonable frequency fund programs that extend initially beyond 1 year without reapplication.
Jill, do you have a sense of that? My sense is it depends, but
Yeah. Yeah, it's, and Jeff, like, I think everybody needs to know Jeff's like just in year one of this. So historically speaking, I can tell you that, Jake, what they've done, they have funded capital. That's how Dean Jean got her mobile medical unit.
Right.
That'll probably be delivered in 2030 or whatever the timeline is on that for delivery. So they have done things like that to demonstrate that ultimately, if they make the investment, that there will be programmatic and impacts on the community. So yes, that's a good example of the capital side of things. And they have been supporting the mobile dental unit for a period of years. But I think Jeff can tell you, and he's had more recent conversations with program officers. What they do not want to do is have you come back to them and say, you're going to create something and that there is no self-sustaining element to it. And they're going to wonder what's going to happen to it in year 3. So they have funded the mobile medical unit to get it up and running, and they recognize the impact of it. But will they be funding it 5 years from now? No. But I think, a good example of something that they did fund in the School of Medicine, MS for the underserved, Bianca Weinstock-Gutman identified a need where people in underserved communities were underdiagnosed or misdiagnosed, suffering from MS. And so they put together something programmatically. It took a little bit longer to get out into the community. And so I think that's what Jeff's talking about, where they got a no-cost extension to make sure that they, were able to see the program through. The program officers have indicated, like right now, when they originally established, yes, they wanted things to start and finish in 12 months, but the program officers that they've hired, and there are a number of them that are situated, or at least 1 or 2 of them situated here in Buffalo, they're super smart, they're super savvy, and they recognize that by the time that you get funding, you get up and running, and then are able to implement. 12 months, sometimes it doesn't work that way, and it's not that quick.
Yeah, and we found them to be really accommodating for, as Jill said, extensions, rebudgets, that sort of thing. Again, at the end of the day, they want to make sure that the money is being spent, that it's having an impact. And, while they have process, they're willing to work through it just to make sure that impact is actually occurring.
And Jeff's office is so good at maintaining the relationship. The relationship should go through them. They maintain it very well. They get the boots on the ground info from trustees and program officers and everything like that. So use them as a resource and for the resource that they are, because they should be managing this relationship with the campus. They're the central point of contact. But at least from my vantage and my experiences, that here's the big difference for everybody on the call. $350 million OSHI total assets, $4 billion. So what, depending on what markets do and how things look out there in the space, that is a big difference for what it can do here in Buffalo. And even with the scale of award, that you might go to OSHI for $50,000 and you can go to Cabrini for $500, and it's still in the ballpark. Yeah. So.
Does that answer your question, Jake? Does that help?
Oh yeah, I was just typing a thank you. I really appreciate that. Historical context is really useful. I'm certainly new to this space, so appreciate it.
Yeah. Well, and I'll tell you, so is Cabrini. They've only been around about 5 years, and every year we have this conversation with the program officer. Well, we're still figuring our way at this, some of this out. We're changing this. This is kind of evolving. So I think to kind of the point of, they're really accommodating to our requests, because I think they're also realizing that they're still trying to figure out the best way to get the money out as well.
Anybody have any other questions? I'll just mention lastly, before thanking Jeff for doing this, for any of you, if you pursue, as Jeff mentioned, LOI, please work with sponsored projects to frame out a budget so that it's realistic. It's not required at the LOI phase, but it certainly is encouraged and advantageous. But if invited to full proposal, this will have to go through, even though it's a foundation, it will have to go through the research foundation. So you'll have to work with your sponsored projects representative. They're very familiar with it. As Jeff mentioned, there's no indirect on it, but the dollars will count towards your awards and your research expenditures for your unit or for your school. So Dr. Noyes, I saw you turned your camera on. Did you have something?
Yes,
that you wanted to
I
comment on?
just wanted to clarify, Jeff. So this is not a limited competition.
It is
We
not a
all-
limited competition. We submitted 12 LOIs last year. The year before that, it was 16. So yes, this is not a limited competition.
All right, so your office here are helping, but not pre-selecting anything.
That's correct.
Very good, thank you.
Yep. If you have other questions, please feel free to reach out to me. I'm happy to spend a little extra time. You know, if you want to have a conversation, Jake.
Sorry.
No,
Feel
that's
like
right.
the squeaky wheel over here. So one of the slides mentioned that the website lists 15% in indirect costs potentially, but that the agreement with UB is no indirects. Can you explain that a little bit? Or did I misinterpret the slide?
You're right. You're right. Some foundations, generally speaking, when it comes to research universities, they want every dollar to go towards your program and to the effort itself. They don't want to pay indirect. And that's the agreement with Cabrini. It differs all over town. OSHI is the same way, Jake. They won't pay indirect for an award to the university. And I'll say this, is Dr. Noyes still on the call from the VPR's office? I'll just say, you know what that just means? That you get more dollars towards your effort. It's not carved out. So.
Thanks for that.
Sure.
Jeff, thank you so much.
Oh, you are very welcome. Thank you. I appreciate this. Again, if anyone has questions, please don't hesitate to reach out. And you know, if you are interested in submitting, the sooner that we know, again, the better, just so that we can just keep in touch with you more than anything throughout the next month as we work through all of this together.
And Jeff, if I can offer, if there's any thing that you want to share even broadly across the health sciences, I'm happy to send something on your behalf to the health sciences distribution list if
Right.
it makes life easier for you. So.
Well, I know that I think the call was probably the big one to get everyone interested. Mark, I know, had already sent that out within at least the med school. I think, you know, clearly others are hearing about it. So ironically, to back to the process that Cabrini is still working through. Ironically, Kathy Carfania in my office and I did not receive the notification that of the time change, even though we had signed up. We were getting emails from all of you saying Cabrini's opening April 1st. You know, what do you need from me? And we're looking at one another going, what are you talking about? Cabrini's not opening April 1st. So, but again, process, somehow we got dropped off the list. So it's a work in progress.
Well, thank you for doing this, and thank you for everything that you guys do, especially because I think we all recognize, you know, just based on level of interest, like what a big deal this is for the universe. And we very much appreciate you managing and growing the relationship on behalf of all of us, truly.
Oh, absolutely. It's my pleasure.